showing you 10-minute transformations for your smile, skin, waistline, and more. And our next guest, Delia, turned to us for her embarrassing dilemma.
I've had these spots for the last 3 or 4 years, and recently they seem to be multiplying. They're so embarrassing, and it's so frustrating trying to find clothes to cover them up. I've also tried makeup, but that just makes it worse. What can I do to get rid of these spots?
Well, Dr. Ordon's backstage right now with cosmetic surgeon and dermatologist Dr. Sandra Lee to help answer Delia's question. Take it away.
That's right. Dr. Lee is back, and Delia, welcome.
Thank you.
And Sandra, we're talking about a pretty common skin problem today that quite a few people have.
Yeah, it's extremely common, and this is called Dermatosis Papulosa Nigra. We don't really call them DPNs for short, yes. And, you know, she actually doesn't have it in the normal way that we see it. We can see it at different levels. People can have really mild form where they just have a few scattered, but we usually see it on the cheeks, on the malar eminences. Very common in Asians, African Americans. There are famous people. Morgan Freeman,
he's
President
got the patch.
Obama, yes, they have them. But people can have a medium severity too, and even be somewhat severe too. So we are going to treat some on her chest, and we're going to use this is actually really fun. I love to use this laser.
She's getting excited over here.
I am.
I know why.
This is,
because it goes snap, crackle, pop.
It does. That's a good way to say it. Yes. This is called the VariLite laser. It's by Cutera. It's a KTP laser. What it's doing is it's 532 nanometers, so it treats blood and pigment. And so it does really well with telangiectasias, with little blood vessels, but in this case, we're treating color. So we're treating her chest. Now, we numbed her a little bit, and everybody has to wear goggles for this, okay? And let me just turn it on here.
That sets up the right distance for you.
Thank
you.
Yeah.
So that sets up.
It does, and you guys are going to be able to hear this pop. Exactly. There's a little guard there. Ready?
There we go.
There's a little baby pop. A little pop, and you know you're done.
Delia, you hearing the popping?
I am.
The popping is a good thing. That means you're absorbing all of that heat, that laser energy.
Yes, and what they're going to look like is they're going to turn kind of gray and crusty. And she's going to actually look like she has a little bit of a mosquito bite there for like about an hour. There was a good one. I was probably talking. But they'll fall off in about a week, so it kind of looks like you have little ants on you for about a week, but they heal very well. And we're going to probably have to do a couple sessions on her because she's got a good number here.
An important point to make is that, you know, these can be confused with something more serious. You need to see an expert that's going to give you your diagnosis of DPN, which is a benign condition, but it can, you know, could be a skin cancer or melanoma.
And absolutely, you don't want to treat those with a laser. You don't want to treat something that could be potentially melanoma.
So go see your dermatologist. And Delia, you've been so good. I want to show you some pictures that Dr. Lee brought with her to give you an idea of what you have to look forward to after this treatment and possibly a couple more treatments. Very good job.
That's it. Yep. Excellent.
Cool. Well, good luck, Delia. Thank you, Dr. Lee. And coming up, afraid to